Hello there, my name's John. I'm 42 years old and I am getting my hip resurfaced in a week's time. I'm just out doing a bit of a cycle in the Pentland Hills near Edinburgh in Scotland. I thought I would do a bit of a video just to track some progress and give a bit of background. So this is my first video and I'll see how enthusiastic I am about making some updates. I'm in a reasonably nice location. I'm huddled behind a wall because I can hear the wind. It's very windy and I'm right in the middle of a little glen which funnels the wind all the way down. But yeah, get my hip resurfaced in a week's time. Background to that is I was a runner for about 15 years, haven't really been for about 5 years now, and always had issues with my right leg, always pulling and kind of muscular issues, and it just kept getting worse and worse and worse until about 5 or 6 years ago it just went bang, and just really struggled with everything since then. Can do a little bit of cycling, a little bit of walking, but not much. I used to be a reasonably serious runner, ran marathons and ultra marathons and what would have been called hill races or fell races. And yeah, I'm not sure how much I'll get back to post resurfacing, but I'll certainly be better than I am just now. I previously had an arthroscopy done on the same hip, which repaired a torn labrum and did some bone shaving, but never really recovered properly from that. Certainly my walking went downhill after it, despite copious amounts of physiotherapy and strengthening, etc. Yeah, so I'm now at the stage where I am looking at a resurfacing, and hopefully, as someone who's reasonably young and reasonably active, that will allow me to move into doing more types of activities I enjoy again. My goals getting back are pretty basic really. Firstly, I'd like to be able to walk properly. Secondly, I'd like to be able to do a bit more cycling, and if I can go back to doing a little bit of running, I think that would be fine, but not too fussed. And if I can do a bit of climbing, that would be excellent as well. Yeah, and just being a bit more active than I am just now. So let's see how it goes. Said video one, I'll try and do one after my surgery, and then maybe in the weeks to chart and progress my recovery. Alright, cheers.